Welcome to San Antonio Living. If you are thinking about taking control of your life, taking control of that health, we have our friends from the Institute for Functional Health here this morning. Dr. Brad Nevarowski is here. He is with the Institute for Functional Health in New Braunfels. You always see Dr. Torres here talking about how to get in touch with us here in San Antonio. But we've got folks all over this area who are really ready to take control of their health. Tell me a little bit about what you guys are doing at the Institute for Functional Health.
Well, this is the time of the year, you know, it's springtime. Everything outside is growing, it's beautiful. There's a vibrancy and energy, and we want people to feel the same way, to be full of energy, to be vibrant, expressing a good level of health. So we're just teaching people the best way to take care of their bodies and support it naturally so that they can see that outward and inward expression of good health.
And of course, the last time Dr. Torres was here, we were talking about a dinner presentation that he had done here in the San Antonio area. It was full of people who were ready to take that next step. They wanted to learn more about how to lead a better lifestyle, how to feel better. But we left out the folks in New Braunfels. So now we've got a presentation going on for those guys.
Yes, that's going to be coming up this Thursday at 7 p.m. at River Hofbrau. And it's just a great opportunity to say, okay, we can talk a little bit about what we have experienced with patients on the show here, but we have a larger setting and a longer time period to be able to help people understand what patients go through, what they can do to actually take an active part in their health and do the things on a daily basis that's going to support a good level of health for their bodies.
It's such a great presentation. I've been to one before, and it's really surprising the things that you learn about what you're putting into your body, or maybe the things that you're not putting into your body, and why that's making you feel the way that you feel. We're talking to folks who are tired all the time, people who have problems with their GI tract or digestion, people who are overweight, people who have diabetes. This is a chance to figure out how to reverse and change all of that, and maybe even get off some of the medicine you take.
And that's a great thing, is people have it within their power to be able to do that. They just have the right plan and the knowledge to be able to do that. So patients, we tell them, should be the best doctor for their own body, and the role that we play should be able to help set them on the path to be able to maintain that optimal level of health. And if they have questions or issues that come up that are beyond their control, we be able to do the things that are going to help fix those issues, but give them the knowledge to say, this is what I can do day by day by day, and then we can have a great level of health going forward.
Okay, so again, this dinner presentation is happening in New Braunfels. It's Thursday at the River Hofbrau, and we do need you to RSVP. The phone number is there on your screen to do that. All right, now let's sort of tempt folks with a little bit about what can happen if you start a program like this. We have got a patient in studio this morning. We're not going to see her just yet, but her name is Evelyn. Yes. Tell me what Evelyn was dealing with.
Well, she's one of the people that we say, you know, when you have to pay attention to your health, people lead busy lifestyles. And she is a neonatal intensive care unit nurse, so high demands for her time on the job.
So she's taking care of everybody else.
Right, exactly. The little ones, you know, very important. And didn't have the time all the time to devote, you know, to making sure she's eating properly and getting enough water in. So little things start to happen then when we get off track. You know, people rush to eat sometimes, or they go long periods without eating, and the body's physiology changes. So unfortunately in her case, the threat of diabetes started creeping up. So she was very close, and you know, one of her other doctors was on her to say, okay, we got to get some changes going here because the numbers are starting to increase. So she knew, and she was just looking for something to do, but the whole great part of her transformation is now she's in the routine of doing the good things for her body. She has the knowledge, so it's empowering to be able to say, okay, now I know this is within my control, and she's already making really great changes.
All right, let's take a look at Evelyn's before picture. And let's take a look at Evelyn now. Looking great, Evelyn. You look beautiful.
Thank you.
So tell me a little bit, honestly, you wanted to change your lifestyle before you had to deal with the onset of diabetes, and you changed up the way that you did things. How are you feeling now?
I feel much better. I feel like I have more energy. I feel like I can go through the day without having those low slumps and high slumps. I pretty much I manage my food intake.
What do you think about the knowledge that you learned from doing a program like this? Because I think it's so amazing, the things that you hear, the things that you learn about what you were putting into your body that you don't anymore.
It was a transformation, Shelley. I have gone from sugar type foods to no sugar foods, and that is what's helped me the most. Having no processed food in my nutrition, no sugar, it's incredible how low my sugars have come.
Yeah, I can imagine you feel a lot better than you did. You look fantastic, and I can tell that you've totally changed your life. And it's so interesting to see how just a little bit of knowledge about what you're eating and why it's bad for you can really change somebody's life.
It is, and it's the things that it's confusing because there's a lot of information out there. So our job is to help people disseminate and find out what is the good information, because there's no one program that just fits everybody.
Sure.
So it's all individual based, because some people are coming in with, you know, multiple health issues, and you have to dig out of a big hole sometimes.
Yeah.
But if you can keep that high energy level, keep, you know, good sleep, good nutrition, and maintain, you know, all the good things that you should do on a regular basis, it's not as hard as people think, you know. So you just have to take action with the things that you do.
It's the first step to take, and we've got a presentation again happening in New Braunfels. For those of you who live in that area, there is an Institute for Functional Health in the city of New Braunfels, and a dinner presentation happening this Thursday. The Institute for Functional Health here in San Antonio, but also in New Braunfels. You can find out more when you check the website, ifunctionalhealth.com. If you would like to get that information that's going to help you change your life, head out to the dinner presentation. Again, it's this Thursday in New Braunfels at the River Hofbrau, and the phone number to RSVP is 830-302-7363 for more information. All right, don't